With a developing story that we've been covering all day, a possible case of the coronavirus in Lawrence.
As we told you at 5, this is not a confirmed case, but the person has been placed in isolation as a precaution. KCTV5's Amy Anderson has spent the day in Lawrence gathering information about this case. Amy?
That's right, Brad and Ellen. This patient was admitted to Lawrence Memorial Hospital and they were tested for the coronavirus. So until those test results come back, that patient will remain in isolation. The Kansas Department of Health and Environment confirmed the patient returned from Wuhan City, China within the past 2 weeks and got sick with respiratory symptoms. The patient went to the doctor yesterday. News of the virus here in the U.S. has really taken off recently, with one of the more troubling possibilities about the virus being that it can take anywhere from 1 to 14 days for symptoms to develop. And in the meantime, the person could be shedding the virus and not even know it. Now, the Kansas Department of Health and Environment says this particular suspected case has been handled very well.
We've had an all-hands meeting with people from the local health department, the hospital where the patient is in isolation, and at the state here at the KDHE. And I think we have a really good plan for monitoring this particular patient and for, should need be, to trace down any contacts.
So that test was sent off to the CDC, and it's going to be a few days before we know if, in fact, that patient does have the coronavirus. Of course, we will keep you posted on the results. Reporting live tonight in Lawrence, Kansas, Amy Anderson, KCTV5 News.
All right, Amy, thank you. And you've been hearing a lot about the coronavirus over the past couple of weeks, but here are some basic facts to keep in mind. Symptoms include a fever, cough, and shortness of breath. So it can be similar to the flu, even a cold. The symptoms can appear, as Amy said, from 1 to 14 days after a person is exposed to the coronavirus. And today, U.S. health officials announced that they are expanding their checks of international travelers for signs of the virus. The checks, which could have been conducted at 5 airports, will now be done at 20 entry points into the country. They also say the risk for most Americans remains low.